everyone, if we haven't met already, my name is Maryam and I'm running to be your VP Global Health for 2025-2026. If this past year has shown us anything, it's that med school moves really fast. And I'm sure that there are a lot of you, just like me, who, despite everything going on, care deeply about the bigger picture, which is understanding how global systems shape health and what we can do to work towards justice and equity in healthcare. And that's why I'm running for this position. Global health is not just a separate branch of medicine. It's actually a lens through which we can understand the interconnectedness of health systems, structural inequities, and the lived experiences of patients not only in our communities but across the globe. Regardless of whether you go into surgery, psychiatry, family medicine, or any other specialty, there are issues that are at the core of global health, such as migration, climate change, colonial legacies, and resource distribution that are going to shape the patients that you care for, the systems you work within, and the ethical decisions that you face as a physician. Exposure to global health will allow us as future physicians to be able to think critically about the root causes of illness and recognize the broader determinants that influence our patients' outcomes. Global health encourages humility, adaptability, and cultural sensitivity, which are qualities that I believe are essential no matter the field that you enter. Because regardless of where you go, global health is going to matter. It's not just about working overseas. It's about understanding the structural forces that impact every single patient. Whether we're in emergency rooms or in family clinics, we're going to see how these issues play out, and global health will give us the tools to be able to respond to these situations with compassion, context, and curiosity. My passion for this work really comes from hands-on experiences. Over the last few years, I've helped support newcomer families in Ottawa through refugee resettlement initiatives. I've also served on youth mental health councils at CHIO, working with marginalized youth and refugee youth, and I've also helped organize campus-wide discussions on health equity and ethics through the University of Ottawa's Bioethics Association. This summer, I've also been given the opportunity to travel to Turkey to work with refugee communities on the ground, and I'm super privileged to have this opportunity, and I'm hoping to learn a lot from it and take the things that I've learned and apply them to conversations on campus and also through advocacy with the Canadian Federation of Medical Students. As VP Global Health, my goals are to create low barrier opportunities for all students to be able to engage with global health, whether that's through discussion nights, events, or simply through bringing these themes into our existing curriculum. I also would like to support the Canadian Federation of Medical Students with initiatives and fostering conversation around migration, Indigenous health, climate, among other issues. And I'd also like to celebrate student voices and help connect you and your ideas with opportunities, whether locally or on a national level. My goal is to make global health feel real, relevant, and accessible, because it isn't a niche topic, and it's a way of thinking that is going to make us better doctors and better advocates for our patients. Thank you so much for taking the time to listen to me and for caring about this work too. And if you ever want to chat, come find me at RGN. I'm always around somewhere with a coffee in hand. And don't forget to vote Maryam for VP Global Health 2025-2026.